Naomi, not met before, hey?
Yes, we have. I know your wife Annette. Jared, yeah.
Okay, of course, yeah. How are things going?
Very well.
Is it?
Very, very well. And you, yeah?
Yeah. It's been a bit quiet on the work front, but picking up now with summer coming, and I think the recession is starting to improve. Hey, yeah. How are you keeping? Are you still staying up there in...
No. I got divorced and involved with an incredible man. We live just around the corner and are about to move. And now, before we do move, I think now I've got to have the surgery done.
What did you have in mind then?
I've got fibrosis of the breasts. In the last 5 years, 2 cup sizes. I'm struggling to find bras, but I can't. It's very uncomfortable. I don't feel feminine.
Yeah, okay. So you're wanting to debulk the breasts, but still have a nice volume afterwards. Or do you just want to go smaller?
I wanted to basically remove everything so I don't get fibrosis again, and I've got other cysts as well.
Okay, we'll chat more about that in a second, but I think let's have a look at your breasts and do some measurements and all the rest of it, and then we can chat a bit more about that. Just take off your top and your bra, and then take a seat. You can put a gown on, and then take a seat.
Must I put the gown on?
You don't have to if you don't want to. Just take your top and your bra off.
So, how's Annette doing?
No good, hey? She's also working on a couple of little projects, but yeah, no. Otherwise, well, man. Now, your son...
Daniel,
how's he doing?
Oh, he's recovering well after the attack.
What happened to him?
He was attacked here in Lakefield by a dog, quite badly scarred as well.
Yeah, so he's badly scarred as well. That was in the paper, hey?
Yeah, just lucky he didn't die.
And your ex-husband, that was...
Joe Gomes.
Joe, that's right. Now it all comes back to me. Okay.
Luckily he's not here.
Okay.
I want to have everything removed and then put in a B cup.
Okay.
Because I've got back problems as well, and my spine is starting to take strain under the extra weight.
Okay.
So they told me 2 years ago, already I'll need to have surgery to have it removed.
Okay.
To get to the psychological,
Is it painful as well?
I wake up every day with back and neck pain. I go to a chiropractor quite often to have the problem sorted. He told me that my spine is starting to take strain. Now I've got 2 choices. Either I have to have work done on my back, or I've got to have my breasts removed.
Okay. No, it makes sense too, to reduce the size of the breasts and the volume. Okay. And otherwise, you had a laparoscopy.
Yeah, I had endometriosis, but I haven't had surgery for that in years.
Yeah, is it? Okay. And smoking? How much do you smoke?
Between 5 and 10 cigarettes a day. I'm not a chain smoker.
Yeah. Do you think you could give up for a couple of weeks before the procedure?
I can try.
26 centimeters. So obviously you need a lift as well, hey?
Yeah, definitely. He said make it as tight as possible. That's my Louis' instruction. Leave me flat-chested.
So you want to go smaller, but you also want to have a nice breast mound, and that's basically what we do. We do like a breast lift, and then we remove as much of the breast tissue as we can, say like up to 90%, We can't remove everything, but certainly we can debulk it by a lot and then just put a nice implant in. And then because it needs a lift, we do it through a keyhole pattern like that. And then it goes out like that, and then like that. And then we basically shift the nipple into the keyhole and then close the keyhole down here. So you end up with a scar around the nipple, straight down, and in the fold of the breast here. So it's like that, and then you'd be fuller up here, then you'd have more fullness up here, and bulking of the breast itself.
I'd like to return to my original breast size, which is a B.
Okay.
Definitely.
Yeah.
I need to go and buy my bras now.
Yeah. Okay. Yeah. Okie dokie. You can get dressed. That's all I need to see. You are currently what? A D?
Going for an E.
Okay.
The other problem that I've got is that we need to do it like ASAP.
Where are you moving to?
Well, we sold the house. The problem is to find somewhere else. Don't know where to go.
Yeah.
We thought of a plot. We want to do some property development and cash flow.
Okay. Are you involved in property at the moment then?
We've got a couple of stands, but the recession has knocked us really hard. Extremely hard.
Oh, yeah. No, absolutely, hey.
Hopefully it'll get better and our cash flow grows.
Okay. So while I print out the quote here, I'm going to have to advise you of the risks involved. You know, the material risks with the operation itself. A very high success rate. Probably the biggest cause for concern is your smoking. The reason being is that smoking is deadly to tissues like the nipple, and we need to lift the nipple like that. If we were going to say just the breast implant, it's not too much of an issue, because what happens is when we're shifting the nipple like that, we're maintaining the blood supply, but that can get quite tenuous. Sorry, man, just let me silence that. Sorry. So you need to stop for about 2 weeks beforehand. What I can suggest as well is that I saw a patient the other day who was using that, I don't know if you've heard of it, that electronic cigarette called Enjoy. And apparently it's quite good in the sense that it does sort of simulate the effect of a cigarette smoke without the poisonous substances in the actual cigarette itself. Because that's obviously the biggest, although we can treat it and we can reconstruct, the biggest risk is that you could lose your nipples basically. So you need to abstain completely. That Enjoy is also fine if you want to do that as a substitute for cigarettes leading up to the procedure. So even like one cigarette can be detrimental, and you need to also stop for 2 weeks after it as well.
In other words, to quit.
Like that's the first prize. That's first prize. But just for that period while it's re-establishing the blood supply to the nipple. And then things like the implant itself. I would put it under the muscle because that will give you the firmness and it will hold up nicely. There'll be no weight on the breast. But the big thing with implant is infection. And when we are putting implants in the body, infection is always a risk. Strangely enough, with this particular operation, it's hardly ever a problem. It's normally when you're just putting the implant straight in. But if we should find ourselves in a situation with infection, we'd need to, if we can't control it with an antibiotic, we need to take out the implant, wait for 6 months and then reinsert it. But it's extremely rare anyway. But it's even more rare with this particular operation because it's a nice procedure.
Yes.
The same with bleeding. Bleeding can occur now and again. Most of the time it's not an issue, but again, sometimes we require, we need to take you back to theatre just to clean out everything and stop the bleeding and all the rest of it. I've actually forgotten to add an item on your. I just want to print out another quote because what we've got a little, unless you don't want it, we've got a little insurance policy which costs 600 Rand as a premium and will cover you for any theatre, any complications that will occur within the first month as a result of, say, any trip to theatre and all the rest of it. So I think it's quite worthwhile for that little cost. I'll just add it in here.
The quote, does it include hospital stay and...
Yeah. As I say, I'm quite happy to do it here because it's not massive. If it was like massive reduction, I'd say, you'd be saving a good 10 grand by doing it here as opposed to doing it in a hospital setting.
And that means that I go home on the same day?
Yeah.
Oh, wonderful. We're just around the corner, basically.
It's just printing out. Okay, I'm just going to... So that's basically it. And then obviously things like scarring. Most of the time people scar pretty well. Sometimes you get people where they kind of would develop what's called keloid scarring or thickened scarring. I've got a couple of tricks that I'll minimize the chance of scarring. There's a small chance, about 4 or 5%, develop sort of thickened scars that would actually require another surgical procedure or some form of revisions or injections or whatever, but it's very much the minority. Normally within a year, 18 months or so that the scarring has settled down, and then the feeling in your nipples can be affected, either increased or diminished, and in about 90% of cases, it'll come back to normal completely. Most of the time, it's actually unaffected. It's normal. So yeah, that's basically the story. And is that what you're looking at quote-wise? And
you're removing most of the breast tissue?
Yes. Yeah, I've said breast reduction. It's just how it comes out on the thing. But basically, the sort of technical term would be a subcutaneous mastectomy. But it's basically to debulk the breast and then leave you with an implant. So in other words, I take out hugely more than I would normally for a breast reduction because normally we leave enough left over to make a nice breast mound. But I'd be taking out more breast tissue than normal in your case.
And you say that I can only do it in 2 weeks' time?
Well, as I say, we could say make it like, I don't even know, like the earliest would be next Thursday.
Oh, excellent.
Yeah, just ask Brandon in the front there.
Like I said, I don't want to exactly do a move. And what's the recovery time?
We're looking at about a week, eh?
A week? A week?
Yeah, a week or 10 days or so. It's really just for that initial stage when the pain, once you're comfortable with the pain and all that.
And I can carry on as normal?
Yeah.
Because I've got to pack and everything. I will come in next week Thursday. And in the meantime, I will go buy that stupid electronics thing and get off my cigarettes.
Okay, good stuff.
So you are actually doing him a favor. He might come in. Thank you very much.